I'm Lisa MacLeod, your Member of Provincial Parliament for the provincial riding of Nepean. This is the fourth telephone town hall I've hosted for Nepean residents since the COVID-19 pandemic began 7 months ago. The last meeting we had, over 10,000 residents joined us with our special guest, Premier Doug Ford. I've chosen this format because we are unable to meet in person, and this is an effective mechanism to get information out while at the same time providing my constituents with the opportunity to ask questions to our healthcare, education, law enforcement, and government leaders in real time regarding COVID-19. I know with the increase of COVID-19 cases in Ottawa, the new restrictions in place, as well as assessment center and testing capacity and the return of our children back to their classrooms, there is a great deal of anxiety in Nepean. As your member of provincial parliament, I am committed to being accessible and with you, which is why I've organized today's meeting. I want you to have the most recent and relevant information to keep you and your family safe. As you know, your Ontario government introduced new restrictions based on the advice of the Chief Medical Officer of Health last Friday to ensure the safety, health, and well-being of Ontarians, while at the same time continuing to keep our education system and our economy open. Those safety measures and restrictions include a provincial mask mandate with certain exceptions for schools, for people with disabilities, and for people eating, drinking, or exercising as long as they are keeping a respectful distance. Limiting gatherings to 100 people indoors for restaurants and all similar establishments. Allowing no more than 6 people at a table in restaurants, bars, banquet halls, etc. Requiring collection of all patrons' contact information, not just one. Enforcing masks and distancing for people lining up outside restaurants, lowering the gathering limit in gyms to 50 people, restricting exercise classes to 10 people, and restricting capacity at meetings and event spaces to 50 people per building. Apart from these, our government is also pausing all reopening plans for their 28 days and limiting social circles to the household only. Today you will hear from Ottawa's Chief Medical Officer of Health, Dr. Vera Etches, and Dr. Falconer, the President and CEO of the Queensway Carleton Hospital. Dr. Etches will provide us with an update from Ottawa Public Health, while Dr. Falconer will share details on our hospital capacity at Moody Drive. Both will be taking your questions. We are also joined by the Directors of Education from all 4 school boards in Nepean, Director Camille Williams-Taylor from the Ottawa Carleton District School Board, Director Thomas D'Amico from the Ottawa Catholic School Board, Directrice de l'Éducation Marie-France Paquette from the Conseil des Écoles Catholiques du Centre-Est, and Directrice de l'Éducation Sylvie Tremblay, Conseil des Écoles Publiques de l'Est de l'Ontario. And finally, Ottawa Bylaws Alison Sandor is on the line, as are staff from the Ministries of Education and Health. In the event you have any questions about return to school with your child's board or bylaw matters in your neighborhood, they are also here to answer your calls. Before I turn it over to Dr. Etches and Dr. Falconer for their statements, and then to all of you for your questions, I want to remind you that this session is being recorded, so if you have any questions or you would like a copy for yourself or to share with anyone else, you're invited to contact my office or the link. Similarly, if we don't get to your questions during this session, please email Lisa at lisamacleod.com or call my office at 613-823-2116, and we will work with the experts on this call to get you a response. Dr. Etches, thank you for joining us. I look forward to your comments.
Thank you, Minister. And thank you to everyone who's joined. I really appreciate, people want to get the latest information and do the right thing. This has been a hard 6-7 months for all of the community trying to learn and do things in different ways. I know it's stressful. We certainly feel that at Ottawa Public Health that our goals are, of course, to limit hospitalizations and people dying from COVID, but it's also to consider the disruption of our society and try to minimize that. And so we see, part of that is making sure that schools are open, that we're supporting our schools to to do things in new ways, as well as, that enables people to work more easily. And we're very interested in keeping businesses open, knowing that the whole health of the population is definitely dependent on our economy and things like employment. And so this is just starting off with the overall goals that I have. And then I want to just spend a moment to paint a picture of our current response. There are some challenges. There are some changes that are helpful. And just finish again with what we can do. There are things that actually make a huge difference that are within our power. So the current challenges right now, of course, is that we do see the numbers of people testing positive in our community are going up. We know that means we're not preventing transmission of COVID between people, and that number that is growing of COVID infections in the community is entering into homes, long-term care homes, retirement homes, where people are more vulnerable. And we have had 8 outbreaks in schools. Currently, we have 12 outbreaks in child care centers, and these are the things we want to prevent. When it comes to detecting the virus and having access to tests, that is improving. The lineups that we've seen at assessment centers are decreasing, and this is with the approach to focus our testing capacity on where it's most useful. And so assessment centers are for people who have symptoms of COVID and people who have close contact with somebody who's tested positive. And then we have pharmacies that are able to provide testing for people who don't have any symptoms of COVID, but they need to have a test for a reason like going to visit loved ones in a long-term care home. The problem with the testing system, of course, is it's not just about getting the swab, it's also about processing the swab, and our labs need to catch up. They're certainly under pressure right now, and so that lab capacity is something that the government is continuing to invest in, to grow, and we're working to make sure our turnaround times for the samples drop. When it comes to our hospitals as part of the response system, I know Dr. Falconer will speak to this more, but they are full. There's no question. It's not that there are huge numbers of people with COVID in the hospitals, but there are a lot of other things the hospitals need to treat and do, and the pressure is there. Also from the situation in long-term care homes, where if there aren't as many beds, we're trying to make sure there's less risk of outbreak by spreading people out in long-term care. That does also put pressure on hospitals. So I wanted to end with the good news, or well, it's not good news, but the positive here that we can do something about this. So we know from the experience so far that when we keep 2 meters distance from others, that makes a big difference. And if we wear a mask indoors, we are unlikely to have COVID transmitted. We, of course, need people to stay home when they're sick and to keep their hands clean. These also help. And the advice is aligned between the province and Ottawa right now. Because of the growth we're seeing in COVID, we need people to limit their contacts to their households, plus 1 or 2 essential supports. We do not want isolated seniors on their own because there's just one person in their home. We know people need social connections, but we are saying when you meet with people outside of your household or those close supports, that you need to do that with distance and with masks if you can't keep distance. So again, thank you for adhering to these measures. It will make a difference.
Hi there. Okay, so we're going to go next to Dr. Andrew Falconer, but before we do that, just a reminder to everyone, it's *3 if you would like to get in the queue to ask a question. Again, that's *3 to get in the queue. And with that, we'll go next to Dr. Andrew Falconer. So please go ahead. Please go ahead, Dr. Falconer.
Thank you. I'd like to start by thanking Minister MacLeod for the opportunity to speak on behalf of Queensway Carleton Hospital, and also take this opportunity to express my most sincere thanks to the community we serve for the ongoing support we've experienced during this COVID pandemic. It means a lot to our staff to have pictures and paintings and drive-bys, and Minister MacLeod has actually been very generous and dropped off a few lunches for us over the last few months. So big thank you to our community for your support at this time. I wanted to start by explaining a few of the preparations we're doing in advance of a potential of the second wave and the impacts it may have on the hospital. We've already hired an additional 175 staff, and this is on a staff of 2,000. So that's a significant influx of new staff. We've made preparations on our emergency department to support larger volumes should we see them as a result of COVID. And we've added some beds to our inpatient units, inpatient medicine, to provide care for our patients with COVID should it be required. In addition, we've built a secondary intensive care unit. During the first wave, we used our post-operative assessment area to act as a second ICU, where we housed all of the COVID ventilated patients. At this point, we need to maintain the integrity of our surgical program, so we've relocated the secondary intensive care unit to an area adjacent to our existing intensive care. We have had a lot of success and a lot of positive patient feedback in an alternate level of care unit that we built in a hotel in Canada. Fairfield Inn has been a site where we've housed 24 of our ALC patients for the last 6 months. These patients are cared for by Queensway Carleton Hospital staff, and we're using our cleaners and our electronic health record and our food services to care for those folks. As I say, lots of very positive patient experience in that. As you know, the Queensway Carleton Hospital is staffing the D'Aubrey Moody COVID assessment clinic. This was built with the notion in mind of seeing about 200 patients a day. About 2 months after starting, we were seeing approximately 400. And then last week, we were seeing up to 620 a day. This resulted in sort of an overflowing of our existing capacity and resulted in unfortunate long lines. With the change in guidelines and the no longer testing asymptomatic folks at these centers, over the last few days, our volume has decreased to less than 300 a day, and that's resulted in no lines, actually. We are going to online booking for this week. Back at Queensway Carleton Hospital, I think Dr. Etches alluded to our capacity. So the hospital is between 97 and 107% occupied every day. Our emergency department volumes are back to pre-COVID activity. And the increase in capacity is largely driven by the loss of about 850 long-term care beds in Ottawa as a result of COVID. So these people need to stay in hospital until such time as we're able to find appropriate accommodations. All hospitals across Ontario have worked very hard to restart our elective activity. This activity was stopped as a result of an order back in March for very good reasons, but it's recognized by the ministry that we need to get back to these surgeries. These patients are waiting. Some of them are suffering in pain. So there's a large effort in all of the hospitals in Ontario to get back to elective activities and to get the backlog cleared up. So at our hospital, if you come in, you'll notice that we've had a fairly large change in registration where we've centralized registration for all programs. This is to make sure we can ensure physical distancing for patients that register at our hospital. This also has actually resulted in a large increase in patient satisfaction, and that folks aren't getting lost quite as much as they used to, and the wayfinding is quite a bit easier than it was with our previous system. I'm pleased to say that at this point we're back to 85% of our surgical volumes from pre-COVID, and that's patients requiring a bed, so operations like hip and knee replacements. In our day surgery area, we're back to over 90% of our pre-COVID activity. So we've really ramped that up. In diagnostic imaging, CAT scans and MRIs are back to 95% pre-COVID activity. And for endoscopy, we're back to 90%. In the ambulatory care area, we're providing a lot more of our care virtually, which also is a very important satisfier for staff and for our patients, but also helps us maintain that physical distancing. We're currently running surgeries on weekends. We've always run emergency surgeries on weekends, but at this point, we have between 2 and 3 operating rooms per day on a weekend doing elective activity. This is to help us catch up with the backlog that was caused by the lack of these services during the pandemic. I wanted to speak about our staff a little bit. As I walk through the hallways at Queensway Carleton, I see that our staff are under some stress. It's been a long haul. The support of the community has been tremendously helpful. And again, I thank you for that. We are undertaking several wellness efforts to help maintain a healthy workforce so we can better serve our community. I just wanted to end my formal remarks with a plea to echo what Dr. Etches had said, and that's to avoid gathering, keep physical distancing, wear a mask, and wash your hands. So with that, thank you, Minister MacLeod, and that concludes my formal remarks.
Thank you so much. I appreciate that so much. Perhaps, Richard, you could let folks know how they can actually make a call or have a question. And I know that we have, we probably have over 30 questions in the queue now, and I think over 2,200 people on the line.
Yep, that's right. Quite a few folks waiting, but still, if you do want to ask a question, press *3 to get in the queue, and someone will line you up. To go ahead with that, we've had our opening remarks now, so we're just going to dive right in to our live question and answers. And again, it's *3 to get in the queue. And please do keep your questions as direct and to the point as possible so we can get to as many of your neighbors as possible. We're going to go first to Jim, who has a question about test results. Jim, are you there?
I'm here.
Please go ahead with your question.
Oops. Hello?
Hi, Jim. If you could just let us know what your question is and who it's to, we would be happy to take it.
All right. How do I do that?
Just ask your question. We're all on the line with you.
My wife and I were both tested on a Friday 3 weeks ago. My test results came up on the Monday on the website. My wife's results have not yet come up. Have they lost this, and does this happen often?
And I'll ask Dr. Etches perhaps to respond to that.
Certainly. So I can speak about what I know about how the system generally works. I don't run the laboratories, and it's important probably to follow up specifically to see where your results might be. What I can tell you about how tests are processed is that usually they are sent from one of the testing sites to one of 2 labs in Eastern Ontario, either the Eastern Ontario Regional Laboratory Association. They're running labs that take all the hospital samples and some of the samples from those kinds of clinics. But the other lab is the Public Health Ontario lab run by Public Health Ontario. And I believe that the samples from the drive-in at the Canadian Tire Centre were directed to that Public Health Ontario lab. Normally, the turnaround time we're looking for is absolutely shorter than 3 weeks. However, there has been prioritization of samples, so people need to have the test done quickly if they're in hospital or there's an outbreak situation. So there are some times where the samples from people who are not in those situations have been put in a freezer, quite literally in the freezer to save them, to be able to run them through when the capacity is better. So this is obviously a situation that is many people are working to change to be able to catch up, and so I think we can take this offline if we get your name and try to connect with the laboratories to follow up on your sample.
And thank you very much, Dr. Etches. And we'll just make sure, Jim, that you can connect with my office. So we've got your contact information to support you in that. And Ontario Public Health has just suggested as well that when you do get your test at registration, make sure you include your family doctor's name because they can also follow up there as results are sent to primary care doctors if that information is provided. Richard?
Yes, okay. And again, a reminder to everyone, *3 to get in the queue to ask a question. Again, we've got another question for Dr. Etches and Dr. Falconer. I'm going to go next to Colleen, who has got a question as a brother in a nursing home. And again, a question about COVID testing. Colleen, please go ahead. You're on the line.
Yes. I believe I have the answer to my question. I just need to contact a pharmacy which is doing these tests and make an appointment. Is that correct?
You're right. This is Vera Etches answering. For people who do not have symptoms and they're not referred by public health for a COVID test, those people should go to assessment centers. Pharmacies are the answer for people who don't have symptoms, but who need to have a test, for example, as you're saying, to be able to visit a loved one in a long-term care home indoors. If you're visiting outdoors, you actually don't need to have a test.
Okay, and continuing right along, we're going to go next to Dennis, who has also got a question for Dr. Falconer and Dr. Etches about really the concern about patients who have left the hospitals there. Dennis, please go ahead with your question.
Yes. Going back, though, this is passed a long time ago, but we were warned by the Italian country that don't do what we did. Don't use the major hospitals as a COVID treating area, but pick on another hospital and don't disrupt the major hospitals in the community. And in our case, we shut down the Riverside and cut out a lot of ORs over the period of time, and we left seniors in old age homes that didn't seem to work by isolation there. They got sicker as the days went on. So my reason why couldn't we have used, let's say, the Riverside as the COVID hospital and be sure that all the patients are going there, and that we would, if a senior has problems in a long-term care, why not move them out quickly and into one of these COVID hospitals so they don't reinfect their other people in the long-term care? That's about all I want.
Hi, it's Andrew Falconer. Maybe I'll try that one. Thanks for the question, Dennis. It's actually very thoughtful. And early in the planning for this, we actually considered that exact scenario. And just to clarify, the Riverside Hospital no longer has the ability to look after patients that are in the hospital. That is inpatients. It's entirely an outpatient setting now. We did actually agree that the Ottawa hospitals would serve as COVID hospitals. So the Valley hospitals were sending most, if not all, COVID into Ottawa. The difference between the Canadian and the Italian experience was we were fortunate with the shutdowns that we did not have the same massive influx and overwhelming of the acute healthcare sector that they saw in Italy. So as time went on, we were all able to look after our own COVID patients. So at Queensway, at one point we had 6 ICU patients and between 12 and 20 inpatient units. So it was felt best to look after them at the site and not transfer them. When hospitals paired with long-term care facilities, that's exactly what we did, actually. We did transfer patients to hospital that required a bit more care than was appropriate for that setting. So that's essentially what we had done. So as time goes on, this is still a potential scenario that we're thinking of.
And it's Vera. I'll jump in as well to speak about the approach in long-term care homes. It definitely has been to try to separate people who have tested positive for COVID and those who have not. Even 3 groups of those who might have been exposed and they're waiting for test results. And so we do use the principle of isolating and separating people who test positive for COVID when it comes to controlling outbreaks.
In addition, we've no longer allowed for 3 or 4 bed rooms in long-term care. And that's in part what caused that loss of 850 beds in the system. But it's very appropriate to help ensure that isolation that Dr. Etches spoke about.
Okay, we're going to continue on with our live questions. We're going to go next to Robert, who's got a question about the connection. And this question is for Dr. Etches. The question is about the connection between testing and the number of cases. Robert, please go ahead. You're on the line.
Oh, hi, Dr. Etches. I was just wondering, to what degree do the increased positive test results represent an increase of the amount of the virus circulating in our community versus simply an increase in testing? Because I understand that we've had a massive increase in testing.
Thank you. We do know that the people who test positive for COVID are just a portion, probably still, of the people out in the community that do have COVID, because not everyone previously was able to access the test, and still now perhaps not everyone is presenting for testing when they might have COVID, partly because the symptoms can be very mild, even in children, often non-existent. So the numbers don't tell the whole story. But we can tell that there is more COVID in our community now, even though there's a lot more testing going on, for a couple of reasons. One is the proportion of the tests that are done that come back positive is increasing. And if we had just a lot more testing going on, but the same amount of COVID in the community, that proportion would be decreasing. And so we see that the percentage coming back positive is increasing for a number of weeks. It's continued to increase, even with more and more testing. The other clues we have relate to where it's starting to enter into other settings that are more vulnerable. So we saw in the first wave, about 2 weeks after there was a rise of COVID in our community, it started to lead to a rise in long-term care homes and other outbreaks. And this pattern seems to be, again, we saw a rise in end of August into September in the community, and we are seeing that was followed by a rise in the number of outbreaks. And the last clue we have is the hospitalizations. Now, that also is a lagging indicator. It takes time to see hospitalizations because the number of days from when you're infected and then you show symptoms and then you really deteriorate to that level, it takes some time. But we do see the number of hospitalizations are now going up, especially this week. And so that is another indication that the proportion of the people out there who get COVID that need hospitalization is not likely to change. And so when we start to see more hospitalizations, that means there's more COVID. So this is the time where we need to drop that level of COVID in the community back down through our prevention efforts. And that most effectively is keeping 2 meters distance from others outside our household.
Okay, thank you, Dr. Etches. I guess, sorry about that, Richard. I was just really excited about the question. And I guess we have a lot more questions to get to.
We do. We really have a lot, so we're going to try and get through them as efficiently as we can here. And again, ask that you keep your question as direct and to the point as possible so we can get to as many of your neighbors as possible. Again, another question for Dr. Etches from Cheryl, who teaches piano and has some questions about that. Cheryl, please go ahead. You're live on the line.
Thank you for taking my call. I am a piano teacher. I teach privately in my home. I have 1 student at a time, and the way I have set up my schedule, I am planning to have 15 minutes between each student to clean and sanitize the piano, the chair, anything they may have touched. They must bring their own books and not forget them, as I cannot I will not loan them mine. They will take their own notes, so I am not even touching their notebook. They must wear a mask, as will I, and I will stay as far away from them as possible. I might add that I am 76 years old, and I had a pacemaker implanted in March. So I am concerned about whether this could impact me and the feasibility of this whole thing. I really would like to be teaching in person if possible.
It's Vera. I'll jump in, try to keep my answers shorter. The challenge for every person like yourself who is in a higher risk group is to make your judgment about the risks you're willing to take. And so I can't say what is right for you specifically, but I can tell you, confirm for you, as you said, you're in a higher risk group for more serious outcomes if you do pick up the virus. And I appreciate what you're saying about the ways you can decrease the risk. So certainly making sure that you stay 2 meters away from your students. That would be, I'm sure, a new way of teaching piano, but that would be important. If you can keep 2 meters away, that definitely decreases your risk. And the wearing of the mask, absolutely, definitely recommend that. You could look at potentially using a medical mask that may provide more protection, and so there are things that can be done to decrease the risk. Also, the duration of time that you spend with people, the longer you spend with someone, the greater the chance of exposure. And you certainly, I think, I didn't hear it mentioned, but you're probably doing is you want to screen people before they come into your home to make sure that they are not sick and they have not been in close contact with someone who was sick or tested positive for COVID-19. There's actually a lovely screening tool you could use that's used for schools. It's on our website, our Ottawa Public Health Schools website, and that screening tool would be something I'd recommend everyone do before they enter into to your home.
Okay, and we're going to go next. This is really a comment for Dr. Falconer from Frank, who lives right by the Ottawa Carleton Hospital. Frank, please go ahead. You're live on the line.
Oh, thank you very much. Hello, everyone. Just a quick comment for the doctors and staff of the Queensway Carleton Comet. A tremendous, sincere, and meaningful thank you to all of you for repeatedly saving my mother's life. On 2 occasions, you successfully treated her for cancer, and then after, while she was recovering, she broke her hip and her skull. And on 2 occasions, you took her from the grasps of the Grim Reaper. You've also treated me for cancer. Both of us are recovering, and we've spent a lot of time in your hospital. I can't thank all of you enough. You're doing God's work. Thank you so much.
Well, thank you, Frank, for that, and I'll make sure I share that with our staff. The support of the community has been tremendous during this, and it really is helping us through this. So thanks for saying that, Frank.
Okay, and we're again moving as quickly as we can. We've probably got about 10 minutes left here. We're going to go next to Sheba, who's got a question about the statistics around contracting COVID-19, and this is going to be directed to Dr. Etches. Sheba, please go ahead.
Hi. I'm just curious to know if there are any statistics about those that had tested positive, asymptomatic, or symptomatic, if they can get it again. I can't seem to get any clear answer.
Yes, I think that's because there's not a lot of evidence that exists yet. We know that when people are infected with a virus, they usually develop antibodies, and that would provide some protection for a short to longer period of time. We actually don't know enough really about how long that protection will last. And with this virus, we understand there probably are specific examples, in other countries where people have, defined that they had one COVID infection and they got better and then they appeared to have another. But we don't have that kind of detailed information and evidence here in Ottawa. And so it really just means that all of us, regardless of our previous actions and infections, need to act now as if we could still be infected with COVID if we come within 2 meters of others. It just means those COVID-wise practices apply to all of us.
Okay, and we're going to go next, and this is a question directed to Dr. Falconer. We're going to go to Patricia, who's got a question about the nurses really in long-term care facilities. Patricia, please go ahead with your question.
Hi there. My question's for the hospitals and long-term. If you've given any thought to regular testing of our running of our nurses to help save the lives and stop the spread to our most vulnerable.
Yeah, thank you for that question, Patricia. The nurses and all staff in long-term care are screened at least twice a day for fever or any symptoms of COVID, and are sent home should there be any sort of onset of symptoms. In addition, all of the staff is trained on how to appropriately use personal protective equipment. And the idea there is to prevent any spread within the home, even if someone's early in symptoms or a patient is exhibiting early symptoms.
Okay, and I think with that, we've probably gotten to... I'm sorry. I'm actually going to take one more. I'm going to get one more quick question here. No, maybe not. I think I'm going to go to our wrap up here, and I'm going to ask. We're going to start with Lisa MacLeod, your MPP, to make some quick remarks, and then we're going to go through some of the other folks that have joined the line here.
Yes, thank you very much, Richard, and thanks all. We had well over 2,200 people on the line today to listen and to ask questions that are important to, obviously, Nepean and the COVID-19 reality that we've got. So if you did not have a chance to ask a question, but you still have one, please call 613-823-2116. That's again 613-823-2116, or email me at lisa@lisamacleod.com. My staff would be more than happy to work with you on your questions. That's why we're here, and we'll also make sure that an audio recording is made available to you if you'd like to request it. I'll be back at Queen's Park tomorrow. I'll be leaving this evening, and I'll make sure that all of my colleagues are kept up to date on your concerns and your issues. And I want to say a special thanks to Dr. Etches, Dr. Falconer, and Dr. Camille Williams-Taylor, Director Thomas D'Amico, and Director of Education Marie-France Paquette, and the Director of Education Sylvie Tremblay, as well as Ottawa's Alison Sander. I know my colleagues have sent staff from the Ministry of Education as well as the Ministry of Health here today to listen to your questions, and I want to conclude before they get to the Directors of Education wrap up with a few points. Our hospital strategies in stage 1 may be different than in stage 2, and Ontario Health informs me the command table is looking at different isolation scenarios, and we may adjust our strategies as COVID progresses. As Dr. Falconer said, they've hired 175 new staff at the Queen's White-Carleton Hospital, and Ontario Health apprises me that we do have in Ottawa approval from government to add 120 extra beds at a new facility that will open in a few days to relieve pressures. It will be run by Elizabeth Briere, called Greyphone, and it will be there to support all Ottawa hospitals. So with that, thanks everyone again, and I will turn it over to Richard and have our Directors of Education talk a little bit about the situations in their respective school boards. Thank you.
Very good. So with that, we'll go to Director Camille Williams-Taylor to go first. Please go ahead.
Thank you, Richard, and thank you, Minister MacLeod. Could you just confirm that you can hear me okay?
Yep, just fine.
You sure can? Okay, great. Thank you so much, and thank you for allowing us to participate in this, because certainly by hearing some of the concerns of the community, it helps us to understand how it is that we are able to ensure safety and safety measures appropriately in our schools. So the only thing that I want to reiterate, and given very short time, is the fact that community safety translates into safety in our schools. And I do want to reiterate as well the fact that the measures that Dr. Etches has spoken about several times are the measures that we indeed are operationalizing in our schools to ensure that we have a layered approach to ensuring the safety of our students. So the masking, the cohorting, the keeping people 2 meters apart as much as we can, hand hygiene, and we have also instituted barriers where we can't have quite 2 meters. We have created circumstances for improving barriers between students. And in my visits to schools, I can tell you that these measures are being undertaken very seriously. But the good thing is that we're still seeing learning happening, and we're still seeing the joy of education occurring in our classrooms.
Okay, and we'll go next to Director Thomas D'Amico of the Ottawa Catholic School Board. Please go ahead.
Thank you, and thank you to Minister MacLeod. Especially, I'd like to thank Dr. Vera Etches and her staff as well. OPH has been wonderful in helping the Ottawa Catholic School Board provide safer learning environments this year. We do know that our schools are well positioned to promote and protect mental health, and that our schools are doing a great job in this area. I also want to thank all of our staff throughout the board for the roles they're playing to provide for students both in person and virtually. For the parents that were able to join the call today, please know that our trustees continue to work with our staff to do our best to support your concerns during the pandemic. And we really appreciate the compassion and patience of the Ottawa community in knowing that this is a challenging time for everyone, including our staff, many of whom are parents just like you are. And we're all in this together. It's a great city, and we will make it through. We'll continue to educate and support everyone. So thank you for the opportunity.
Okay, and next up we'll have Marie-France Paquette from the Conseil des Écoles Catholiques du Centre East. Please go ahead.
Thank you very much, Richard, and thank you very much, Minister MacLeod, for having us today. So, le Conseil des Écoles Catholiques, we're working very hard to keep our schools safe for students and all staff. We are collaborating and working really hard with OPH to make sure all the procedures are well. Our students and staff are following them to keep, like I was saying, those schools very safe. Want to thank all our staff for going over and beyond to deliver education, remote or in presence, to all our students, and students that have to isolate. Well, at least they can pursue their education. So we're really grateful for this. So thank you, everybody, for collaborating with our school board. Thank you.
Okay, and lastly to Sylvie Tremblay of the Conseil des Écoles Publiques de l'Est de l'Ontario. Please go ahead.
Good afternoon, everyone. And as my colleagues, in our schools, all safety measures are in place. Our staff is very committed to making sure that all kids are safe and getting the best opportunities to learn and succeed, because that's what we're all about. And maybe the only thing I'd like to add is that the mental health and wellness of our kids in this context depends on the mental health and wellness of adults around them. So whether we're parents, we're staff working in schools, the way that we're managing our stress and our anxiety in front of this virus has a big impact on the kids, and it's important that we be aware of that all the time. Thank you so much.
Okay, and with that, we've come to the end of our time here, and I'll just ask our host, your MPP Lisa MacLeod, to make final and closing remarks.
Thanks again, Richard, and thank you to all of our healthcare and our education support on here today. And would you please convey on behalf of all of us our thanks and gratitude to our frontline healthcare and education workers. This has not been easy. There is no rule book on COVID-19. We're experiencing all of this together, and you've certainly made all of us very, very proud. Again, To all my constituents, thank you for joining us. As I said, over 2,200 on the line today, listening and asking for some guidance and getting that guidance from our Chief Medical Officer of Health and Dr. Falconer. And I just want to encourage you all as we navigate these waters, particularly in a second wave, to have my constituents call our office at any time. We are open, accessible, and we are here to help you. My phone number, again, it's MPP Lisa MacLeod. I am at 613-823-2116. Again, 613-823-2116. And my email address is lisa@lisamacleod.com. And we're here to assist you, and we are here to provide you with the best guidance we can. So thank you all very much, and thank you, Richard, for hosting us today.